Hello everyone. I wanted to talk to you today about a situation that can be really all too familiar to some clients who struggle with depression. And that is, what do I do if the antidepressants don't work? So you're not noticing a change in mood. Maybe your doctor has tried you on several different types. Perhaps he's tried you on, you know, different classes of antidepressant, and just nothing seems to be changing the depression levels. And so I wanted to let you know today, just for your information, some of the things that I've seen my clients do or have procedures that they have done that have really been of help to them. So you know that antidepressants are not the only option for depression. They're the ones that work most often, but sometimes they just don't help. Now, I want to preface this video by saying I'm not a medical professional. I don't prescribe, and so I'm not offering this as any sort of medical advice. All of these things should be discussed with your doctor or the medical professional that you see, perhaps your psychiatrist, to see if, anything along these lines or these options is right for you. So again, like I said, this video is pretty much just for information purposes. So let's say hypothetically that you've tried the antidepressants and your depression is still really, really low. And so your doctor may look at offering you probably primarily one of three options, and they each increase slightly in intensity of treatment. The first option they may offer is called RTMS, which basically is a machine that uses a very small volt of electricity to stimulate your brain through your skull, and it just hits that part of your brain that may be underactive perhaps during the depression, and it kind of gives it a bit of a jump start, let's say. This kind of a procedure is done in office with the machine, and you are conscious for it. They don't put you under, so you're able to drive yourself there and drive yourself home. I've had some patients tell me it felt like someone was knocking on their skull in one little spot. Some patients have experienced headaches from it, but that's most of the side effects that they experience. So it's a relatively, in the grand scheme of things, painless procedure, and for some people it works miracles. They have one or two series done, and they've noticed a massive improvement. And the RTMS is available through Alberta Health Services, or there are some private clinics that also offer it. It's just, as I'm sure you know, private clinics cost. The next option that a doctor may offer is actually ketamine, and a lot of people will hear that and think, like, really? My doctor's going to prescribe me ketamine? And it's used in kind of like last resort cases for people who struggle with treatment-resistant depression. And you go to the hospital and you're given a very moderated, well-managed dose of the ketamine, and then afterwards you can choose to engage in some psychotherapy while your brain has, kind of let some of your guards down and has relaxed and perhaps come a little more open to work on different things psychologically, and maybe not so rigidly trapped in the depression. And for some people, ketamine works wonders. Now, it needs to be through a medical professional, obviously. It needs to be medical grade. So this is something you do not want to attempt to do yourself. This is something that needs to be done through a clinic or through one of the hospitals. I believe that, for ketamine, I believe that Covenant Health offers ketamine treatments, and you can also get them done privately through physicians' clinics. Now, you'll have to check in with Covenant Health because it's been a few years since I've talked to them about whether or not they do it. The last option that may be presented is one that sounds really scary to people but actually isn't, and that is ECT. And that's typically what we think of when, you see them in movies with, like, I don't know, the little paddles that they're shocking both sides of the person's head for, and the person goes, and so, yes, that is still done, but no, it does not like that. So, each CT, like the RTMS, is done in a series, so that's several treatments in a row. And the treatments are done in hospital on a special machine, obviously, and the person is under anesthetic when it's done, and so it causes the seizure in the brain, but there's nowhere near the trauma that, maybe 100 years ago used to happen when they did it with people who were awake. It's closely monitored by doctors, by medical professionals, and the electricity can be given to both lobes or hemispheres of the brain, or only to one. It depends on what your doctor believes is most effective. And I have worked in psychiatric facilities where people have undergone these on a regular basis due to their particular diagnoses. And I've also worked in community where people have had this done and they've gone back into the community and they've re-entered their life and everything has worked out fine for them. And personally, I haven't seen any major side effects from it. The primary side effect I hear from people is that, there may be some memories that are a little bit foggier than they were, but they're usually not important memories. It might be you remember the color of your backpack from kindergarten or something, and all of a sudden that's a little bit fuzzy. But most of the time, memory is the only thing that's affected, and it can be affected relatively mildly. And, with the series of ECT, obviously, you need a ride to and from, and people tend to be quite tired afterwards. They tend to sleep a lot. But you go through the series, and after you're done, people have found it extremely effective in treating treatment-resistant depression, to the point where, they may have had to have a few series, but they feel like they're almost back to their old selves again afterwards. So each of these therapies are consistently used, and they are found to have good results, and the side effects of them are not as major as often popular culture kind of thinks that they are. There is an emerging field now working with psilocybin, which is the chemical within magic mushrooms. Again, though, medical grade, if you do it from a professional, from a psychiatrist or a doctor who's licensed, they know exactly how to dose it and, how to work with the person while they're administrating it. It's shown some progress. It's not tied as tightly to treating depression as, say, ketamine, ECT, or RTMS. However, some people have reported some success with it. And so, again, that's something to, chat with your doctor about if you're noticing that you've tried several different types of antidepressants and nothing's changed. Now, one thing I do encourage people to do is, explore with their doctor the antidepressant side of things, because based on what my clients report, antidepressants and specifically SSRIs are still some of the medication that people experience the least amount of side effects on. And so, often clients will exhaust that particular type of treatment before their doctors will consider moving on to anything more intense. So hopefully that's some helpful information just to guide you into a bit of a discussion with your doctor. Again, like I said, I'm not a medical professional, and so I'm not recommending anything here. This is just for you to be armed with knowledge when you go into the discussion. And I encourage people who are struggling with depression that maybe isn't responding to traditional treatment methods to, not lose hope. Don't give up. There's still things that can be tried. There's still things that can help. It's just a matter of getting into the medical system or accessing the doctors who provide this particular type of treatment. If you are considering something more intense, or your doctor is thinking about something that requires, more specialized type treatment, I usually recommend my clients request referral to a psychiatrist because that can help you get in the door. Some doctors will refer directly, but not all of them. And so again, that's part of the discussion you may want to have with your doctor. So good luck. Hopefully you find some of that information useful, and I will talk to you again.